get us started with a little bit of housekeeping. Really want to welcome everybody. Thank you so much for being here. My name is Kim Porter. I'm the executive director of Be a Part of the Conversation. In just a minute, I'm going to also turn it over to Mike Blanche, a clinician with Ethos Treatment. So this is our first in a series of programs that we're doing. We're going to be here every Tuesday night. It'll be a different login each week or a different registration each week, but we will be here every Tuesday night at 7 p.m. And we're going to be hopefully resuming in-person community events once the threat of spreading or contracting coronavirus has lifted. But until then, we're going to do our best to provide these kinds of online opportunities so that all of us can stay connected. We have several panelists you're going to hear from tonight. You'll see and hear them, but as an attendee, you're in viewing mode only. So you're not visible on this webinar, nor can we hear you. You do have the option to type in questions. So there's a Q&A down at the bottom of your screen or your phone or whatever device you're using. You can go to Q&A, type in a question, and then you'll see it says ask questions. So you have to click on that, ask your question, submit it, and we'll be getting to those after we hear from our around through our panelists. I'll be checking your questions throughout the program. We have a lot of attendees signed on, so we're going to do our best to address as many as we can. We are recording this webinar, but your questions will not be visible. You will not be visible. Only the panelists and myself will be recorded. So we're going to share the link to this webinar tomorrow on our website and some other platforms. So just want to make you aware of that. But again, all participants other than the panelists and myself are private. I have set up a page on our website. I'll show you toward the end. I'll share my screen and show it to you. It's just conversation.zone/pathways. And you'll receive an email following this to let you know about that. That's one of the places that we're going to have access to the video. Okay, so let's go ahead and I'm going to have you get started with there, Mike. So here is Mike Blanche. Thank you so much, Mike, for getting this kick started. He's the one that a week ago said, we got to get going online here and doing some programming. So yay, Mike.
Thank you so much. Can you hear me okay? So I just always do that. So thank you first off to Kim. You know, this all came out of a conversation that we had last week, literally in 1 week's time. We were able to put all this panelists together. And again, I want to thank the panelists. I want to thank the participants for showing up tonight in a relatively quick, rapid period of time that we've all had to come across how to manage ourselves and how to manage the way we avail ourselves to treatment and people that suffer from substance abuse treatment in isolation. And so we really need to continue be a part of the conversation. And I was lucky enough to be one of the first presenters and live action a number of years back. And I'm grateful to be a part of this format, whatever format. I see prevention as a key element in prevention. A key element in treatment and prevention of helping others to see where and how to access treatment and to let people know, even in the middle of this global pandemic, we still need our folks, especially to know with substance abuse, mental health issues, that treatment is available, how to access treatment, what's happening in treatment. And so Kim and I quickly were able to pull these great folks together out of their time and their energy just to kind of come across and talk through what they're doing and how they're working through. Loneliness and a loss of normal and disconnecting from our new norm. We as a nation are collectively hit with this wall of exhaustion and isolation. And as individuals struggle with substance abuse and active substance abuse, what I'm getting calls about this week are the way that folks in active addiction have been able to hide or get their addiction enabled in certain ways is all kind of coming loose because they can't hide living in their own homes and being quarantined. So a lot of substance abuse is coming to the fronts of people's homes and houses. So again, with that in mind, I wanted you guys to hear from the great panelists of crew. If they're in need of struggle and treatment is available. What does that look like? And all levels of care we'll talk about. I'll talk about my program, Ethos, later on, and I'll talk about really the core of why the panelists are here talking about their level of care. I represent Outpatient. But again, this vulnerable time with folks that struggle with substance abuse in early recovery and how to connect them. I was so impressed personally. And I have to thank so many people in Classic Recovery in 12-step, the way they rapidly responded by setting up Zoom meetings across the country locally has been an amazing feat. To Chris and your outfit with Unity Recovery, Miramont putting alumni meetings together. So the amount of onpouring of services of just free tele support for folks in early recovery has been amazing. So I want these guys to kind of speak to what's already out there. So I want to start this though with saying this, that, you know, I want to change our language and get better at our language, and I want to drop the term social distancing. I think that's a farce. I don't think that's real. I want to say accurately that we're physically being distant, but we're being more socially conscious, and we need our social connection of recovery just to adapt to this format. And so telehealth, telecommunication, and telepresentations, we need to connect other people. So I want to drop the term social distancing. Every time I hear that in the news, I'm like, just forget it. It's not that truth. Our truth is that we're having to physically disconnect it, but that doesn't mean we have to stop, you know, emotionally, mentally, and spiritually connecting as we do just in this format. So with that, I wanted to first start with the most acute level of care. I wanted to ask Zach to talk a little bit about what he's experiencing from the acuity of residential detox, what that's like, how challenging his team is from that, and then is also his longer term program too. But specifically, I wanted to hear like what your worries or concerns are for folks in detox status. So Zach, were you able to unmute yourself? That's my first question. It doesn't look like you have been able to. I don't know, Kim, you might, no? Okay, can you unmute everybody? I think that's what needs to happen. We're having our fun, you know, first event. We got to get through all of our technical fun glitches here. I had the same issue, so when I went to unmute, oh, good. All right, Zach, there you go. Yep, you're up.
Live now, can everyone hear us?
Yeah.
Okay, thanks, Mike. And before kind of talking about the detox, I just want to dovetail a little bit about what you said. So as a person in recovery myself, I actually feel, although from a society standpoint, we feel that we're more disconnected now as a person in recovery with the availability and learning how to connect virtually and through technology. I've actually felt more connected personally in my recovery. I think I've made more meetings in 12-step recovery than I have probably in the last 3 years on a weekly basis. Because I'm getting text messages regularly from friends all over the country saying like, hey, my home group's meeting at this time, can you join? And you actually, it's a really kind of cool experience that I was not expecting actually when this started. But yeah, so my name is Zach Snitzer. I'm one of the co-founders, co-owners of a new detox program in Abbottstown, Pennsylvania called Novo Detox. It's a 52-bed standalone detox. So it offers detox and medical stabilization typically between 5 and 10 days. From our standpoint, so obviously a substance use disorder and addiction as a chronic illness, our philosophy is that sustainable recovery comes through long-term care, right? So long-term treatment, descending levels of clinical services, you know, recovery support, monitoring, and so forth over kind of a long-term period. But typically for most people, their initial access point to recovery comes through kind of the acute level of care from a medical detox. So what we've actually been seeing is similar, Mike, to what you said. Is for the first about a week and a half ago, as all this with COVID-19 started, we weren't hearing a lot, right? So everything was shutting down. Society was shutting down as a whole. We're being told to stay in our houses. And then in Pennsylvania, at least, you know, first liquor stores were closed, and now everyone's kind of self-quarantining in their own houses. And what we've heard from a lot of, you know, most of the people that make the initial calls are parents or spouses, right? Like concerned loved ones. And what they're seeing is a lot of the behaviors of the people that they care about are now kind of in their face regularly. So the people with substance use disorder aren't able to isolate as much as they typically would or hide the behaviors that they were hiding from their loved ones. So that's kind of what we're seeing, and we're having people call it. And the concern really is, like, are you open? Are facilities open? Is treatment available? Should we come? Is really kind of the question that we're getting. I can tell you from our stance, so we're taking all the necessary precautions, but we're pretty much in the position, in my opinion, as providers of mitigating risk as much as possible, right? I don't want to say that we are on the front lines of this, because I think we are in terms of addiction, but we're not doctors, we're not nurses, we're not in the hospitals and the ERs doing this, but we are on the front lines of the addiction crisis. So I think it's our responsibility to stay open and then mitigate risk for both patients, potential patients, and staff as much as we can. So we've implemented all the health and safety guidelines of the CDC. We're obviously kind of beefing up our screening protocols beforehand. We are consistently making sure that the health and safety of our staff and the current patient population are being checked regularly, multiple times a day. We're a new facility, so we actually have the ability to quarantine patients on their own if necessary. So we're admitting patients, but we are admitting them and they're staying in their own rooms. They're being monitored, 24 hours a day. Our level of care, obviously, for Detox is 24/7 medical staffing, as well as recovery support. So they're being monitored regularly, but we don't want to, kind of have them congregating through large groups regularly, right? So we're basically bringing them in, medicating them as much as possible, and then trying to get them to the next level of care if that facility will accept that. And the good thing is, not everyone obviously needs a next step in terms of residential. They may need, based on their clinical needs or their kind of social needs, their family needs, they may need to go home if they're a single parent of 3. But a lot of facilities are doing telehealth, so we can obviously refer them to an IOP that they can access telehealth services as well as other recovery supports in that area. So that's kind of what we're doing. So in terms of kind of the direct patient care, it's the same. It's just more mitigating risk in terms of, incoming patients, and then making sure that they have services once they discharge, whether that's 5, 7, or 10 days afterwards. And that may be to a residential facility. It may be to an IOP. It may be just to some recovery supports and community supports, whatever kind of their need is, but making sure they're there before they leave, and that the health and safety of that patient, once they discharge, is still in place regardless of where they're going.
Zach, a quick question somebody had on the panel that's said to us was basically, you don't mandate level of care at the end of care. You personalize or individualize their aftercare plan, right? So like you said, that doesn't have to just go to residential. They can go to a lot of different levels of care, like you said. Is that fair enough?
Yeah, absolutely. So from our perspective is, and I think most providers do this regardless of level of care, is when somebody picks up the phone, you're already getting kind of the information in terms of clinically what they're going through, what their medical needs are, what their recovery needs probably will be, but also socially, where are they potentially returning to, what's their family like, a safe living environment for them. So all that really kind of takes place before they actually admit to the level of care. And you kind of plan that in terms of what that individual client needs while they're there, and then once they discharge.
Great. And all your services are happening on site. You're not doing anything remote or anything telehealth for the Detox protocol.
Correct. Yeah.
And the name of the program again is?
It's a Novo Detox. But that level of care is obviously, for us, we're a standalone. We do typically between 5 and 10 days, whatever the medical needs of that patient is. And I know John can speak to it also, but that level of care is a lot of times integrated within the residential level of care also. So your traditional kind of 28-day facility, which can a lot of the times handle those medical needs as well.
Awesome. Thanks. I'm seeing the quick ones, Kim, this quick questions, and I just want to ask the panelists before we get to the end of the bigger questions. So thank you. Was there anything else you wanted to address, Zach, or you think you could?
No, I think that's it. I think John can really talk about kind of that integration from Detox to residential in terms of the level of care.
Awesome. Thank you, Zach, so much.
Yep.
So John, you're up for residential.
I am up. Good evening, everybody. Thank you for having me. I wanted to say thank you to Kim and Mike for putting this together. We're very grateful to be part of it, and that was a great intro, Zach. I appreciate that. You know, I was thinking when Zach was talking, and I say this all the time about our field, it's a very unique field in the fact that, you know, a lot of us are competitors on paper, but we're all friends. And I think we really found out about that, like during this, like, you know, Miramont has done a lot of things that people call us and we tell them what they're doing. We call them and they tell us what we're doing. We're in a position where we're all trying to share anything we can right now to do the best thing that we can in a difficult situation. So I feel very fortunate for me in being part of Miramont. I mean, the nice thing about Miramont is we're actually part of Mainline Health. And so it's, you know, we're in a unique position that I'm not a standalone facility where I'm trying to figure out what the government is saying, what the CDC is saying. The hospital system is doing everything for us at some level. So we have 5 different hospitals. We obviously have a bunch of different ERs and stuff like that. We have a chief of infectious disease. I didn't even know we had a chief of infectious disease until this happened, but we have a chief of infectious disease. And so for us, it's really great because a lot of things are being taken care of for us as an organization. We have weekly calls with the CEO and the chief of infectious disease. They tell us all the things we should and shouldn't do. And so from that standpoint, we're really very lucky. Very lucky. From a Miramont standpoint, it's been really very eye-opening for me to realize the talent level of some of the people that I work with. A lot of the people, really almost everybody, is I think as Mike kind of said, you know, the whole social distancing thing, you know, I understand the physical part, but it's almost brought a lot of people closer together. I know I feel that, like Zach said, from the recovery community kind of has that feel to it. And then from a work standpoint, anybody will do anything that they're asked right now. And so, you know, it's definitely been a challenge. I think the, you know, the only thing I can really say is, like, for us, and I assume for most other people, there's really no precedent for this. And so when this first started, I think we weren't really sure what to do. And I think within the first maybe 2 days, you know, my boss, who's in charge of behavioral health, basically set up, we have 2 COVID-19 calls every day. Saturday and Sunday included, just at Miramont. And the initial calls were very much like, well, what are we going to do? And then we just started digging in, and it became one topic after another, which was, okay, we have a lot of people in the building. What are we going to do? Mainline Health and Miramont's main thing is the safety of our patients and the families and our employees. And it was like, what are we going to do? And so the first thing we did is, kind of like Zach said, you know, we sat down and said, we have a lot of people. What are we going to do about the groups? Like, we have patients in the building. What are we going to do about them? And so we literally restructured our entire clinical program to the best of our ability to redo everything so that people were as safe as they could be. So instead of having, you know, large group, we used to have a large group at 10:30 every morning. We would have, you know, 6 small groups in different rooms. Instead of having individual meetings in counselor offices where there's 1 counselor and 8 people in a small area, we would actually take that group, make it a smaller group, and put it in a bigger room. And so from day one, we literally went in and started doing, you know, everything we can. And it's been an evolving thing. You know, we're licensed for 115 beds. We made the decision last week that we were going to go all private rooms, which essentially cuts our census in half, which is not always easy to do for the community, but we're doing what we can do for the safety of the patients and for the safety of the employees. We've gotten into such detail, as I'm sure Zach and everybody else on the phone has, is, you know, things I never even thought of. You know, I think the first week we started and somebody said, well, we need to wipe down the buttons on the vending machine. Right? And somebody said, okay, who's in charge of wiping down the buttons on the vending machine? And then somebody said, are we going to allow a vendor to come in and fill the vending machine? And so we've gotten into such great detail with every single thing. And I'm largely not in charge of any of that. And you know, but I work with a lot of great people. So, you know, at Mainline Health and at Miramont, you know, and I'm sure everywhere else is doing similar things, like anything that was, you know, a patient could touch, like things like a salad bar, gone. The patients used to get their own food. They don't get their own food anymore. They're handed their own food. Things like getting a cup of coffee. You used to be able to get a cup of coffee, get your own coffee, gone. We now have somebody serving everybody coffee. We had to go through the building and close all the water fountains. And so then we had to sit down and come up with, okay, well, how are we going to get everybody to get water? And so even little things like, you know, when you're part of a residential program, you have plates and napkins and forks and knives, which sounds silly, But when you're in something that is contact-based, somebody said, well, we need to get rid of all the forks and knives. So we went out and purchased all individually wrapped forks and knives for everybody. And so when I say we've literally gone down every time we have a call, like somebody says, well, what about this? What about this? We're trying to address everything as they come. Probably one of the first things we did organizationally at Miramont was we locked the front door. That's a tough thing to do. We're in a business where people need to come into the building. But we had to do that again for the safety of the patients and for the employees. And so everybody gets screened before they come in the front door. We basically canceled any outside visitors, which means we canceled alumni meetings, we canceled family meetings, things we didn't want to do, but things we felt we had to do from a safety standpoint. Any single patient that comes in gets screened by a nurse, right? So we do all the screenings for admission and everything over the phone. We have a script that we go through. A lot of it is, things that the CDC is recommending, which is, have you traveled? Have you traveled internationally? Have you been to New York City? That's a tough one. Not everybody likes that one, but the reality of it is that's considered an epicenter in the state, in the United States. Things like that. How have you felt and so forth. So anybody that's actually coming in the building actually gets their temperature taken. When people deliver food, the Cisco truck pulls up to the back of the building, we take their temperature. They're not allowed in the building until somebody goes out back and actually checks them and asks them the same question. So we've been very, very serious about the safety of our patients and of our employees. All non-essential personnel across the board at Miramont are working remotely currently, which is a much bigger undertaking than it sounds. Our entire outpatient offices from Broomall, Exton, Women's Emotional Wellness, and Media are all remote. Broomall is a big office. Exton is a big office. All outpatients, IOPs, PHPs, any individual sessions, psychiatric services. If you need your Vivitrol prescription refilled, we can do everything remotely. Even in the hospital setting, things like Bryn Mawr Psych, anything that can be done remotely, we have removed those people from the building for everything. We have building maintenance staff that are somehow working from home. I'm not really sure what they're actually doing from home, but they're somehow working from home. I think the cool thing about it is everybody has been willing to chip in on anything. If you need any help or any, people are willing to do it. We roughly are responsible for somewhere in the neighborhood of about 800 patients a day. And so that includes Miramont, all the outpatient, inpatient, psych, and everything. So we have a lot of people and a lot of moving parts, and we've been very lucky for stuff like that. So we have had no real dip in census from an outpatient standpoint for adolescents or for adults, for mental health or substance use. And the last thing I'll say is, Mike mentioned at the beginning, one of the things that really, being in recovery myself, one of the things that kind of pained me was, we were discharging people on Friday that went to go to a meeting on Saturday and there weren't any. And literally they're like, within, 2 days, my church called, the Flowertown Center called, the Lansdale Clubhouse called. And I was like, well, why don't we open up alumni meetings? And instead of doing 1 a week, let's do 3 a week. And instead of it just being alumni, invite anybody that wants to come. Right. And then we followed that up and we started launching first responder meetings. And we said, okay, so if you're a first responder and you need help, we want to have some 12-step online meetings for you. And our thing has been kind of the same as I think everybody else's is we don't care who comes. We just want to offer help. We're in a very unique position. And, all of us that are on the phone is that we can actually do something. And so we've been very lucky that we can put out a lot of meetings. Even with the family programs, people have just started videotaping themselves, clinicians, to make videos from their phone that they can send to families. So overall, it's been really a very, it's been hard. I think I've been working 12 hours every day, including weekends, for probably the last 3 weeks. I thought I was going to sit around and play with my dog with sweatpants on. But I'm very grateful that I really do. The organization's done really wonderfully in making sure we're all safe. And I think we've done pretty good as an as an industry in kind of communicating with each other, because we're all trying to do the best thing so that people can still get care. So that's all I got.
Awesome, John. Thank you so much. That was awesome. Somebody just asked, you know, if we can get a list of those meetings, and Kim, I'm going to direct that question to you. At the end, we're going to have a list of things that they can follow up on your website of tabs of different events or different meetings online.
Yeah, absolutely. We have a special section called Staying Connected that's got loads and loads of ways to find online meetings and all kinds of stuff. We'll talk about that at the end. Yes.
Great, thank you. And specifically, so again, my name is Mike, and I'm supposed to talk about that step down from residential to outpatient. And as an outpatient provider and what I've been practicing for 25 years, you know, I've been a continuum of care person and helping folks when they get out of residential level of care and providing a safe place. So Ethos is still running. We 2 weeks ago transitioned all of our sites, Philadelphia, Westchester, and Plymouth Meeting, all to telehealth, as well as a lot of our providers have done as well, a lot of our friends. And John said it really well, collaboration, not competitiveness, is how we're going to get through this. And we've been talking all the time. I talked to John numerous times. I talked to Zach numerous times, and Chris as well. And I was on the phone with Doug Tiemann this morning from Karen, and we had a conversation about what they're doing up there. And he was very transparent about how services are happening. So we're all trying to come together as programs. So I'm not trying to single out anyone, but what we're doing is telehealth, and we provide a safe environment for folks in a confidential way to get help. So we transitioned all of our folks, and successfully everybody came over, including a MAT program, and I want to speak to that in a little bit, medication-assisted therapy, IOP, rapid around services for folks on MAT. But we will and are working with psychiatrists that are still seeing folks either telehealth or in person, and medication management is still available for folks in the community. There are community centers that are open for that, so please know medication-assisted therapy is still occurring. So from a treatment perspective, our IOPs are all virtual. Our luck is that we've had 12 amazing therapists that are long-term therapists in the field that we've been able to kind of tap into, that we meet and talk regularly. We had a group supervision today of 12 of us come together to kind of process out, and we're talking all the time about how to improve these services for telehealth communication. But we have groups, individual counseling, outpatient counseling, relapse prevention groups, family programs, trauma tracks. Specifically, Karen Levin does an amazing trauma-focused relational repair work. So again, like all those services, even experiential work can happen virtually. She actually ran, and I studied on her experiential group yesterday morning. It was fantastic, and it's a different thing. There was a question that came in before the panel started that adolescent services are available. And so Center for Families is one, you know, my wife's program, Sean Rogers, I know, is on the call. And it's a fantastic adolescent program. So taking your kid in for an evaluation can happen virtually. So at all centers, my friends, Patty Ann McAndrews, Adolescent Advocates, she and I talked last week about how she jumped onto this. So again, insurance companies are recognizing this, luckily. The state finally recognized it quickly within a week time. The turnaround is recognizing that it's a state license. We're all licensed providers, all of our services, even in the telehealth level of care. And insurances are recognizing this from individual to outpatient. And Rehab After School is also doing telehealth in all their centers as well. So again, the community is supporting each other to make sure that services are available and looking out for folks in isolation. I'm just looking over my notes. I usually don't take notes, but I'm making sure I didn't miss anything. The one piece about medication-assisted therapy, we didn't even market it it's about 6 months old, because we wanted to make sure it was working well before we started to market it. And we're working with a Dr. Aviva Foyer. So our folks are seeing her for the medication, and then they're coming to us for treatment. And Liz Ferris is running a specific track around those folks, and she has higher retention of folks attending those groups virtually. And she's having better attendance and better success of capturing people ready to talk and open up in this virtual level. So I think there's an intimacy in counseling, and as an individual provider, I'm psyched about having some intimacy. And I had a client the other day show me around his room, show me his house, and it was really cool to allow me to see how he's dealing with this crisis. So again, I'm pretty excited to be here. So I want to transition though to talking about transitional living. Mark, who I've never met personally, but I've heard great things about your recovery house. I wanted you to kind of touch on like how you're handling things and the recovery houses. I know like Tim from Synergy House is on the call, and a couple other folks from recovery houses are on the call, but can you speak to what recovery houses are doing, and you're specifically at where you're at? So please.
Yeah, how you doing, guys? My name's Mark. I'm with the Bridgeway House. Thanks for having me tonight. It's a bit of a tough situation with us. I mean, we're on a 10-acre farm out there in East Fallowfield. Between a couple of houses, we have 33 guys. So they're doing, normal daily life with working, and so I'd say about out of 33 guys, we probably got 20 guys that are still working. We offer transportation. So I have a full-time driver that starts at 5 o'clock in the morning, and he does pickups from work and such. And we have a partnership with Express Employment down there in Fraser to get the guys plugged in with jobs on our route and such. So right now, when this all happened, basically we're quarantined. So nobody's allowed to leave the house unless they're going to work. So there's a lot of Zoom meetings going on. Mondays and Wednesdays, we do in-house meetings anyway. It's open to the public. Obviously, we're not having any outsiders come in. So we have enough guys to make a good meeting. So we're doing that right now. We're doing a lot of Zoom meetings. It's just tough because these guys are in the house all day and they're getting stir crazy. So we got a lot of projects going on around the house and just trying to keep these guys busy. It's just tough. We kind of changed the rules around, with basically all the rules have kind of changed in the house. So, I mean, if you're not at work, you're quarantined in the house, and, we're everyone's required to, do at least one Zoom meeting a day. People are still, they're doing Zoom meetings with the IOP. They're doing them online. The guys that are attending IOP. With the financial situation's a little tough right now. With some of the guys not working, they're not able to collect unemployment. So we're just kind of hanging in there and kind of taking it day by day and see where this goes. We're in a little bit of a tough situation when it comes to, we have a contract with US Foods. So we have a tractor trailer that backs up our driveway every 2 weeks and gives us 2 weeks worth of food. So we're okay there. So no one's allowed to do any Walmart runs or anything like that. We got a driver, so they just make lists and we go and pick up what they need. I made the announcement I don't know, a week and a half ago. I said, these are the rules. This is what we're looking at. I knew there was going to be a couple guys that wanted to go back to their families or their girlfriend's house and be quarantined. I was pretty surprised though, out of 33 guys, I only had 2 leave. I thought more would leave. So far so good with that. We've been blessed. I mean, my biggest thing is the isolation, these guys being home all day, and it's just, downtime is not good. But so far so good. We haven't had any relapses. Everyone's attending. It's pretty cool to see that these guys, how they're sticking together and they're kind of making the best out of this, you know what I mean? The best they can. So, I guess, that's pretty much it,
Thanks, Mark, so much. I
Think of
really
anything
appreciate it.
else. Yep.
No. And speaking about that isolation and things to do in these times, in these quarantine times, that's why we asked Chris to come out to talk about what it's like from online meetings and online meeting support and how Unity Recovery and then, how you guys have responded to the need. And Chris, I don't know if you've been able to unmute yourself as well, or so can we get Chris unmuted? I promise he'll
there we go.
Nice. Okay, great. All right.
Thank you.
All right, Chris. So I'll turn it over to you.
Hey, thank you very much, Mike, Kim, and everybody else. A lot of people are doing a lot of awesome work to keep all these resources available for the community, and it doesn't go unnoticed, right? And like John was saying, we all help each other. So my name's Chris. I am a person in long-term recovery. I am a peer recovery support specialist and family recovery specialist for Unity Recovery. We're a nonprofit recovery community organization. We are based right in Manayunk, and while our drop-in center is, as of right now, closed, for anything in person. All of our mutual aid meetings have been suspended, and all the peers have been working from home. We are still 100% functional, and it's pretty cool, right? Because the last time that we saw that all of us saw each other face to face was at the Pathways to Recovery a few weeks ago, and it was the day after that. We knew we were going to be closing down that weekend until, to be determined when this thing passes. And it was just kind of like this idea that we had. We saw like, AA and Smart Recovery, Recovery Dharma, and all these different mutual aid groups moving to the online format. And, one of the things that we do at Unity Recovery is we have all recovery meetings, right? And it really, and it's cool because the Pathways to Recovery is where it was the day after that we discussed creating an all recovery online meeting, and it welcomes all pathways, right? So it doesn't matter if somebody's from a 12-step fellowship or somebody's suffering from mental health or disordered eating or substance use. Everybody is welcome to these meetings. And the original plan was to have 2 a day or 2 a day twice a week. So there's going to be 4 total a week. And within, I think, 12 hours, we had 3 other organizations across the country partnered with us on it. And now we are running 7 a day, 7 all recovery meetings. We have 1 family support meeting that we're running every single night, 8 o'clock. We have an LGBTQ plus meeting we're running once a week. We have a women's meeting we're running twice a week. And we're actually starting a life skills workshop. I believe that started today. And that's going to be on employment and financial literacy and, all kinds of things like that. And
your services, Chris, are free, by the way.
Yes.
For those people who don't understand. So this is all funded through a foundation, and you guys have you're independent, and that's an amazing thing for folks to understand.
Right. We have no criteria that anybody needs to meet to come in us. There's no health insurance, Medicaid. Everything is 100% grant funded. The only thing that you need to do for services is to say that you want them. And we welcome everybody. And again, we don't just work with people with substance use disorder. It could be mental health, disordered eating, any kind of behavioral disorder or quality of life concern. And while the offices are shut down, it's actually interesting, right? Because one of the things I usually talk about is how we reduce barriers to engagement, right? And, a barrier could be getting in touch with us, right? So we have a million different ways that people can get in touch with us. They can call, they can text, they can DM the Instagram, they can message us on Facebook, they can send an email. There's just so many different ways, and they can come into the center and see us. And it's interesting now because we've actually seen our engagements with individuals go up significantly since this has gone down, because people can sit right on their couch. Individuals that, are seeking support can sit right on their couch. They can reach out to us, and we can have engagements over Zoom, just like we're doing this webinar right now. And it's a really cool thing. And with these meetings, we've actually had a little over, so in 2 weeks, and I want to make sure I get these numbers right so my executive director doesn't come down on me. In about 2 weeks, we've had 26,000 logins across the 94 meetings. Now that 26,000, right, that doesn't mean 26,000 people are sitting in the meetings, right? It means,
no.
Unique logins, right? But we have been averaging the early morning meetings, we've been getting 50, 60. Some of the midday meetings, we've been getting up to 200, 250 people that are active in the meeting, sharing. And it's just like going to a meeting outside, right? Face to face. And it's really spectacular. It's a safe place. And we've actually written, because a lot of the other mutual aids around AA, NA, Smart Recovery, Recovery Dharma, Refuge Recovery, they've all moved to this online format. We have made our operating procedures on how we run these meetings and try to keep them safe from people getting in and being offensive and things like that. We've made our safety guidelines and our remote operating procedures completely public. They're on our website so that any other organizations that might be struggling with things like that can access the way that we're doing it and hopefully utilize it to help.
Great. Chris, thank you so much. I really appreciate it. And then to Kim, do you want to talk about the parent support groups that you've kind of helped and you were a part of from its beginning?
Sure. So we started 2 weeks ago with holding a Wednesday night meeting at 7 p.m. So we've only held 2 of them so far, but second one increased in numbers. So that was looking good. It worked really well. It's a lot like this. This is a webinar, but that's a Zoom meeting format. So same kind of thing though. People can choose to either be visible on video or be private just on their phone, just to listen in or to chime in if they like. But I'm going to actually quickly share my screen just to show a little bit of what people can find. Hang on one second. So here we have on our website, it's called Staying Connected. What Chris just talked about, a lot of that is listed here. And I'm going to share this out with everybody who's registered for this webinar, and it'll be on our follow-up page. But what Chris just talked about, here's his Unity Recovery down here. In the Rooms is another great resource. Here's a link to the online AA meetings, NA meetings, Never Alone. And then we have Al-Anon, Nar-Anon. So that's kind of more in my wheelhouse. By the way, I'm the parent of someone who's in recovery. So these resources are vital to me as well. And I just want to sort of quickly say that it's so absolutely important that family members stay connected as well. This is something that we're often, kind of have this a lot of shame attached to this and isolation anyway. It's never a good thing for us, which I learned early on. So I really encourage parents that might be listening, or if you know any other family members who need this kind of connection. We really need each other, that we have a lot of resources and other information that we can share, we can talk about. In our meeting on Wednesdays, it's kind of an offshoot of the parent partnership meeting, but anybody at all is welcome to attend. We've had a person in recovery share her story. That was last week. It was awesome. Tomorrow night, we have one of our group leaders, Laura, is going to be chairing and has a really great topic about what we're learning about control as a parent while we're dealing with this situation where we don't have a lot of control with the coronavirus, and how that might help to educate us about, how we interact with our loved ones. But you can see on here, we also have links to smart apps and Facebook groups. We also really encourage people to check out this section on podcasts. And again, if anybody has anything you'd like to add to this, email me. You can just shoot it over here to this info@conversation.zone. And I'll add more and more and more in here. So we want to make this like a really great repository of information so that people can find all of that. This is the link to those meetings that we hold on Wednesday nights, but I know lots of other groups have them. And here are the Facebook groups. Here is the Rosemont Parent Group. There are also meetings for people who have lost a loved one. So we have, I think there's some, Grief in Common. There are a couple of those as well. But again, I would love to know if there are more, and hope you will send me that information as it becomes available. I know it's growing and I know there's a lot, but the more options we have, I think the better. Sure. And since I have us on sharing my screen right now, this is going to be, this is the follow-up page for what we're talking about tonight. So this is our website, conversation.zone/pathways. It's live right now. Here are the presenters you're hearing from. And then here are some tabs that will take you to like additional information. And we also, I know we have a lot of people who work in the field. I have a lot of resources here listed for treatment providers. And then I have some related news stories that have to do with, with our current situation with regard to recovery challenges. So I'm gonna stop sharing my screen. Okay. So that's my piece. And I wanted to ask Bill Stauffer, who's on here as well. Bill, now that we've heard from all of our panelists, I kind of want to open it up to all the panelists and to Mike and to Bill, everybody to see. Bill, is there anything that you want to add regarding anything that you've heard so far? Tell us who you are first, Bill.
My name is Bill Stauffer. I'm the Executive Director of the Pennsylvania Recovery Organizations Alliance. We're the statewide recovery community organization of Pennsylvania. A lot of years in recovery and have been involved in our service system in all kinds of different ways, running residential and outpatient programs before coming to ProA. And I just kind of want to reiterate what was said by some of the other panelists about collaboration across our system and what people are doing to help people get into and stay in recovery. And so, from our end, we also very proud and happy to see everybody jump into action talking to service providers about how are they going to move services online, talking to residential providers about the different kinds of issues that they were going to face, and also across the recovery community. And so we put a lot of resources online as well about all the different types of support that is out there, things that people may want to think about in recovery, about stays on eviction for people who may be living in situations and have lost their jobs, differences that are occurring with unemployment so that there's no wait week, and making sure that there are a lot of resources out there for people. And that's been important to us. We've set up weekly calls so that we can hear from people in recovery and people working within our service system, so we can identify and get to barriers. And it's just been, I think some of us were talking about, we're blessed with the having the ability to do something about the circumstances that are occurring, and I'm very proud to be working in this service system. There have been some very long days. Some things also that have occurred with like the closure of the liquor stores. I did some work to get some information out because we want to make sure that people are aware that I think having done clinical work, I know I've worked with people who did not know they were physically dependent on alcohol, or how risky that could be to suddenly withdraw from alcohol. So did some interviews with the Philadelphia Inquirer, with CNN, the Daily Beast, to make sure that people knew about that, as well as let the whole recovery community in Pennsylvania know, and have them think about checking on neighbors and things like that. So one of the things that I think is really important, as it was identified that we need to physically isolate from each other, not socially isolate, but physically isolate, is that we need to focus on some really important things that are tenets of the recovery community: hope, connection, and purpose. And so one of the things that we're challenging groups to do across Pennsylvania, and people in recovery across Pennsylvania, is to work on those three things. And we have a lot of people who are isolated, and we're getting other people to sort of mobilize and check in on them, and make sure that people have things to do, because that's good for our own mental health and it's good for our communities. And I think that one of the things that I'm most proud about right now is I think we're going to have an opportunity for our whole community to shine and to show that we're people in recovery, like myself, like many of the people on the panel here, and our allies are important members of the community, and we have a lot to contribute. So thank you.
Bill, thank you so much. Can you say your website address? So somebody asked, and I'll make sure it's on Be a Part of the Conversation Zone as well. But what's the quick email address or not email? I'm sorry, website of yours.
It's pro-a.org.
Great. I knew it was really simple. So thank you. I really appreciate it.
Absolutely.
And I want to echo what Bill said. I believe in the folks that are on this panel. I believe on a lot of people that are on this call. I know a lot of personal people in recovery. We've been through a lot in our addiction, and we've been in a lot, and we've dealt with a lot of trauma and dealt with a lot of complexities. And again, we didn't let that define the rest of our lives. And I don't want to let COVID-19 define the rest of our lives either. I want us to kind of get settled in our core of who we are and what we're about. Is if we can't keep the physical door open as Miramont has to do because the way CDC set up, we are keeping the virtual door open at any level and every level as we can. So Bill, thank you for jumping in and talking about your resources across the state lines. My first question is to Bill, actually. Are you seeing this kind of pandemic across the state as well in other areas in Harrisburg and central PA? Are you feeling we're all kind of mobilizing the same way as we have in eastern PA?
Well, I think how people are mobilizing and what they're doing is differing from place to place. But yes, it is, at this point, it is affecting all of Pennsylvania, although in different ways. And as an example, like some of our rural communities who may not have great access to the internet are doing things like setting up phone trees so they can check in on each other we're thinking about people who online or virtual support services, for somebody who's brand new, it's a little bit harder to make that engagement. So people checking in on individuals there. So it is sort of spread across Pennsylvania from some of our more urban areas into the rural areas, but I believe that most areas in Pennsylvania are affected now. And because we are a small family of people in the treatment and service of individuals with addiction, we're all talking to each other around the state and sort of learning from each other and making sure that we are working well together.
Great, thank you. At this point, it's open up to everybody. So if you guys have any specific questions, I'm sorry, I thought I was going to be able to have an ability to see people that I can call on, but unfortunately, you're going to need to type, so I can't really prompt you guys all to do that. So I do want to thank a lot of people that I did ask to participate and show up tonight, including folks from AA and general service to just be there and available to know. And so we've spoken about that. We've set up links for both AA, NA, and also Unity Recovery. So I'm really grateful that the responsiveness of the Classic 12-step to keep people out of isolation. And my experience with outpatient providers is actually newcomers feeling a little bit more okay with kind of logging on from their home and being a visitor to meetings. And it's actually been a little bit easier to talk clients in and be like, dude, you're just sitting at home. What else you got going on? Why don't you just sit in a meeting and check it out? Does that make sense to people? So
I was kind of wondering that myself. I'm wondering if maybe some folks are seeing this as there's like some little silver lining that perhaps somebody who was intimidated about, you know, being someplace in person might reach out in a more anonymous way. I guess I'm thinking more about the online meetings. I don't know, Chris, if you've experienced any of that, but I can remember a year ago, there was a horrible snowstorm and we had at the last minute cancel a parent support group meeting. And one of our parents hosted a meeting like this. We had 23 people on the call, and one woman who shared for the first time, had been coming for months and never felt comfortable sharing. And she said, wow, I'm talking for the first time. And it actually opened the door for her. I'm just wondering if anybody has experienced any kind of positives like that.
Absolutely. Real quick, the adolescents at Center for Families, they're seeing a higher retention rate for the kids, and the kids are talking more and open up more. And we're actually seeing it on an outpatient basis. People are opening up in ways that I didn't think they would, and I'm really surprised by that as well. Do any of you guys want to talk about that as well? And my other question was, can you speak, or John, did you want to answer that question?
No, I was just going to say we had an alumni / 12-step meeting on, it was yesterday, with a guy got out of Marworth, I think on Monday, and he went home for a week and he was like, you know, I'm just sitting home, and he loved it. And so, yeah, it's been, I do feel like that. I do feel a lot of people are, most of the people that we've had on most of our things are really, really grateful. You know, we're in a situation where we have a disease that wants us to isolate, and we're telling everybody, you know, to go isolate. So I think the fact that people can get online and do all these things has been really helpful. That's the feedback I've been getting.
Mike, just to jump on top of that. So we have a program of extended care that offers some outpatient IOP services in Maryland. And we went about 2.5 weeks. We went all telehealth for IOP services, as I think everyone's doing. And we had a lot of trepidation about what that would look like in terms of being able to connect with, you know, the clients and the retention rates, and is this actually going to work? And we actually had one of our therapists write something about his experience, and we saw something very similar. So like, I come from I guess more of not that it's old school recovery, but like, you know, the in-person connection is kind of, you know, vitally important to recovery. And what we saw in terms of the engagement with our groups and a lot of the young adults was that they were more engaged. The retention rate was, we were almost at 100% going on 2 weeks. And they're actually taking more of an effort to connect with each other through technology than they were beforehand. And they're actually getting more excited about it. And I think it's from and I'm not that old, but I think from our staff and some of the clinicians that, you know, a lot of the 18, 19, you know, younger adult patients are used to connecting in this way. And we just recognize that, right? So like they're used to connecting. A lot of the times they're connecting through technology as is. And when we kind of implemented that, we've seen really, really good results, and we were pleasantly surprised. So it seems that and I've heard that from other programs of all, you know, different levels of care, that this is, I think that this is changing a lot of, in terms of clinical services and recovery support, you know, going forward. So that was a really positive thing that we've seen.
So one question that Adam Lush from Caron Foundation asked us was, you know, what kind of impact are we seeing on the home front with everybody kind of being in the home with the family dynamic? And I'll say we're doing a lot of more family work. Our program at Ethos, we have Pat Dowling doing a family specific program, and he's a separate family therapist, interventionist. We're excited to have that family component going. But all of our therapists are doing more individualized family therapy because of that dynamic of everybody living in the home. I don't know if you other panelists want to talk about the family and how everybody's kind of being at home now with the young adults and adolescents. Does Chris or Zach want to talk about that at all, or John? Or?
I can say our engagements with family members that are signing up for peer services has it significantly went up over the last couple of weeks. And I think it's based off what everybody had said, right? Like, I think we're not used to being in this close of proximity to each other for this amount of time, right? And, you know, that goes for roommates, family members, like anybody that is together for this extended period of time. It's stressful, right?
Absolutely.
And you know, from our online meetings that we've been running and the partner organizations that we have. So we're partnered with somebody in SOS Recovery. They're in New Hampshire, the Alano Club of Portland, they're in Portland, Oregon, and We Connect Health out of Seattle. So anybody that is connecting through us through these meetings or however, no matter where they are in the country, we can connect them with family support, with peer support, anything that's going on, we can get them connected with somebody. And the family support has been much higher than it was while we were open.
That's great. One question to Mark, and one other question that came up. Somebody asked about how Chris King asked, are you taking on new folks to the halfway house? I know that, like, I talked to Timmy Brooks at Synergy Recovery House. They're taking on new folks, and Theo at Healthy Habitats, they're taking on new folks. Are you guys taking on new folks, and kind of what's that process like for you?
Yeah, we are taking on new folks. We actually just opened a new women's house in Salisbury. Also, I didn't mention that we also support MAT.
That's great to know. Yeah.
Yep. Yes, we are. We haven't, to be honest with you, we haven't had any beds available since this has all happened. But we are, with the women's house, we opened up about a month ago. And we are accepting new patients or new residents there. Yes.
Has the admission process changed much, or are you just doing a little bit higher screening? Or?
Yep. And, you know, obviously we can't get out to the treatment centers to do interviews. So, and, you know, basically what happens, I mean, the people that are working, because we even have women that are finding jobs right now. I mean, there's a lot of places still hiring, like Giant and Wawa and things like that. And if they get sent home, or if they have a cough, I mean, we're on it. So they're going to get checked out. So we're not, we're not messing around with that. Anybody that's sent home for anything, they go straight to the hospital. So guys, I mean, we clean the house 4 or 5 times a day. When the guys get home from work, they're required to get in the shower. Everyone's doing their wash about every day. So we're on it the best we can. But yes, we are accepting new residents.
And a quick question, where are you guys located again? I say like west of Westchester before you get to Coatesville, somewhere around there?
Yep, right in East Fallowfield. Yep.
Great.
Right off Stroudsburg Road.
Great.
Kim? Also a question for Mark. Somebody just asked if there are age limits at the houses.
That's a great question. For age, can you unmute yourself, Mark? Is there an age limit for what kind of population you're working with at Recovery House?
Most of our age, most of my population is late 20s, 30s, but there is so 18. We have a 60-year-old there. So we're all over the board with that. We don't have an age limitation. You got to be 18 or older, but most of the guys are in their 30s.
Great. I got a confusing question that I want to read out loud to everybody, and I just want to make sure I say it correctly. So if the person hears this question and they want to write it in again, please do. We are a community of action committee in Glenside, PA, and are trying to coax some people into some kind of treatment. What are 2 or 3 best suggestions for teleconferencing? We don't want to overwhelm with too many choices. So like, what are kind of some of the ways to kind of help people kind of engage into treatment, you know? And I'll answer briefly. Pat Dowling is an interventionist. He's an independent interventionist. I know there's interventionists that work, Pat Brown for Miramont, and a couple other folks that work for treatment centers at RCA. They have their own folks in-house. So again, there's residential programs that offer that. There's independent interventionists, but do you guys have any suggestions on ways to help coax people into kind of talking with a therapist? And would anybody like to answer that question? I will if you guys don't.
I'm just trying to, are they asking to how to coax somebody into engaging in telehealth or just in treatment in general?
I think telehealth.
Right.
Telehealth.
Or
my short credit, or even just treatment. My short version is it's the same awkward conversation of trying to talk somebody into going to treatment or going to a therapist's office. It's getting them in front of the screen and saying, hey, give this therapist a chance, talk through some questions. And again, an independent evaluation doesn't mean you have to go anywhere. It means you got to get honest about your behavior and evaluate and be open to some cognitive restructuring and think about how you're viewing it. So when I talk to families about how to get somebody on a call or how to get somebody into treatment, it's a really simple explain of just like going and talk to somebody. It doesn't mean anything. It means more to me to hear you find a place to talk through what you're thinking about your substance abuse. So yeah, I hope that answers the question.
I think also just, stressing the fact that it's really not a commitment at this point, right? So a lot of people feel that like, if there's an intervention involved when you're actually physically taking somebody to treatment, typically it's that like concern, okay, well, there's going to be a major intervention. There's going to be a major change. We're going to either force them or not. This is literally probably even easier than picking up the phone, right? Take a couple minutes. Obviously things aren't working or there's concern from a loved one. There's not a commitment. You're not agreeing to get help. You're not agreeing to you're just agreeing to have a conversation with somebody.
Cool. No, that's great. And John, do you want?
Sorry, I was going to just say, someone made the comment too, that they're hearing from a lot of parents that, at least the way I'm reading this, is that by seeking online help, by attending an online meeting, perhaps they're actually kind of taking that first step toward recovery. So that is definitely a silver lining.
Absolutely. That's great. Are you, John, is Pat still available to talk to families about just interventions over the phone? Or?
Always.
Okay.
And I think, the nice thing about nowadays is because probably everybody on the phone and just about everybody else in our space right now is doing virtual everything. So even if you want to get on with somebody at the Ethos or no matter where it is, they can get on the Zoom pretty quickly to do that.
Great. I know that there was a question around adolescence earlier, and I hope I answered that question. I know that when I brought up adolescence earlier, Sean kind of chimed in and said that not only kids are attending, but they want to participate. They want to show up for adolescence. That's an amazing thing. Think about it. You're a kid stuck at home with your parents. So your outlet could be actually treatment and getting to see other kids that you met in treatment. So that's actually been a really good sign to us. So we're really happy about that. Did you guys have any other questions or any other thoughts as we're available?
Mark kind of touched on MAT, and I know that was something that was brought up to me by someone earlier today. I don't know if Bill, if you have anything to say about MAT or anyone else that has any insights about how that might be handled in any different way during this.
I will just say that during the COVID-19 crisis, there are a lot of regulations that they're looking at least waiving or easing during the period of time that this crisis is occurring. And so, for example, a lot of the services that are occurring online, the Center of Medicaid Studies and SAMHSA have eased the way that these services can be provided to sort of reduce some of the privacy restrictions that are on that. In respect to MAT, there has been some easing of take-home standards as well as obtaining prescriptions for medication by physicians so that it's easier to do that without getting face-to-face visits and things like that. So things are easier to do now over the phone. And some of the restrictions on the number of patients have been eased some so that people can get access to medications that they need without a lot of barriers.
I'll add to that, and I'll preface this by saying I'm not a doctor. I'm certainly not a physician in any case, but I think last maybe Wednesday or Thursday, the DEA came out, and for physicians, they no longer have to be in the room with the patient to prescribe. So like Bill said, I think like there's all these different like levels of authority that are relaxing things. So for us, I don't know if that means the initial induction happens that way, but like we can refill people's prescriptions and do a lot of that those things online that we just couldn't do before.
Thank you, John.
Did I bring the meeting to a screeching halt?
No, I was just scrolling through all the questions, and one person nicely asked, like, can they know how many people were on this call? And at one point there was 48, 49 people total, and I thought that was really good. And now we still have 45 people on the call. So again, I want to thank everybody for coming out tonight. I think the real mission, the real message tonight was the agility as providers of being able to kind of realign ourselves and to be available for folks in a telehealth way or in a direct service way, a direct line way, in a safe way for our clinicians and our clients and our families that we serve. So I'm really proud of our community. I'm proud of be a part of the conversation, and I'm proud of all the services that we are able to offer, including prevention work. And so I do want to mention that this is going to be a beginning of a series that next week, Kim nicely asked me, because I was on the phone call, so be wary if you get on the phone call with Kim, you may get asked to do a talk too. So just as a warning to anybody on this call. So no, I've been known to talk a lot about the impact of technology on adolescent development and the concerns related to substance abuse and a setup as substance abuse. And clearly in this day and age, clearly these past couple of weeks with technology, we've had to reshape, reevaluate how we're approaching this. And I treat process addictions. One of my most complicated cases today I'm dealing with is a family and individual just getting out of Restart. And this young guy is addicted to online. And he's saying, but wait, this is how I communicate. I'm alone and isolated in my own home. And it's such a complex process addiction that aside, those types of individuals I will speak to, but for the majority, just how we look at technology and how we can reshape our view and see it as a healthy way. But also, I do want to let folks in on that we got to look out for technology overload. I personally have been kind of overloaded this week by looking at screens, and my eyes are getting tired. My eyes are getting dry. I'm getting headaches. And so little tricks like that of just knowing, like, when I get off this call, you know, I've got to go for a walk and I got to get some downtime from screen time. And knowing that there's a balance, even in this time of connection, in this relationship time and Zoom time, and when we're offline, and knowing how to do that in a healthy, appropriate way. So next week, I'll be leading this topic, and I'll be here next week with Kim. You're all welcome to come back if you want to listen to me again, talk about that complex topic. And again, I'm really excited to be here tonight for the lead off of be a part of the conversation in this format. So again, why don't we say, like, thank you to everybody. If we go around, is there anything that you guys didn't get to, Kim,
Yeah,
is where I say you.
there's
Yes.
another really great question that came up, but also I wanted
Sorry.
to mention that at the end of this, you're all going to be getting a survey, and we definitely want to hear what you'd like to hear about in the future. That's going to absolutely determine what our topics are going to be coming up. We have Mike scheduled for next week, as he just described, but we have the rest of the time open, you know, all the Tuesdays, you know, and coming up. So, oh God, we have some more questions coming in. But yeah, just want to mention, please fill out that survey or contact us in any way, info@conversation.zone, and let us know what kind of topics you'd like us to present in the future. Here's a great question from someone. Will all of you continue with teleconferencing, maybe not to this extent, after the shelter at home ends?
So I can jump in on,
Yeah,
I can
please,
jump
Chris.
in on that. So at Unity, teleconferencing has always been an option, which we've just exercised a lot more, obviously, with the pandemic going on. The online meetings were not always a thing, but because of how successful they've been and how many people have been involved and invested in them, we will be continuing them after the crisis ends. Maybe not to the extent that we are, maybe not 7 times a day, but it will all still be available going forward.
Great. Kim, do you want to answer some of those questions that came in, specifically the last one?
Yes, it will be available to view. This presentation that you just saw will be available on our website. It will be on conversation.zone/pathways. And you should all be getting that link at the end of this. And here's another one. Do you think the easing of regulations, for example, MAT, by the way, that means medication assisted treatment. I think probably everybody on this call knows that, but just in case, will that remain in place when this quarantine ends, when it's been proven to have worked efficiently?
So let me clarify that the easing of regulations doesn't have anything to do with efficacy. I think we have known, and all of our government partners have known, that medication is a effective pathway to recovery. That isn't what was eased. What was eased was some of the oversight issues around how to access those medications. And I think some of them have to do with safety. And I don't know. I don't want to speculate. I would suspect that some of those would go back into place, but I'm not sure which ones. But I think what is occurring right now is a balance of risk between people not having access to medications because of the unique situation that we're in, and the risks of not having, say, face-to-face doctor oversight of people getting medications initially and things like that. So I think there's sort of essentially a balance of risk here, and I think there's a recognition that at this time and place, we need to make sure that people get their medications so they can sustain their recovery.
Absolutely. And the follow-up question the gentleman had was that, you spoke to it, that ease of being able to connect people to treatment and making sure that people are aware that it's a viable option and the real research behind it, and coupled with really good therapy or coupled with programming around it. So it's not just a standalone. And I think, Bill, you spoke great to that. So thank you. I appreciate that. John, do you want to speak to the MAT tracking as well, or anybody else?
I don't think I have anything better than Bill did.
Okay, great, good. And so when it comes to this tonight, I think as our first night with everything going on, I think you guys did a great job. I really can't thank the panel enough for showing up. I know this was all pulled last minute. If you're on the call and we're meant to be a part of this panel, please know we're so happy that you're a part of our solution and a part of our team. And again, that connection that we have with each other, I think we should just strive to develop and work through in this time. So Kim or Zach or anybody, does anybody have any last words on the panel before we finish up?
I just really want to thank everybody, all of you, for doing this. I know you're burned out on Zoom meetings, but this is how we stay connected right now. And I'm really grateful to all of you. I hope you found it worthwhile. And yeah, I might be knocking on some of your doors. And I just want to kind of close maybe with what Chris told me when we were prepping for this, and I spoke with Chris Golding on the phone about it. He was telling me, maybe you can tell the story, Chris, about somebody you know, is it Montana, North Dakota, someplace?
Yeah. So somebody that had I'd connected with through all this online work that we've been doing. I believe it was Montana that this individual was from. And online's nothing new to them. He said the closest meeting to him, they have 2 meetings a week, and the closest one was a 45-minute drive, and the other one was an hour and 15-minute drive. And he said that's his norm.
So be Montanans is what we're saying, right?
Yeah.
We can do this. If Montana can do it, we can do it. We're very lucky in this region that we have a lot of meetings at our disposal, a lot of places to connect and get help, but a lot of places in the country and in the world don't have that access, and this is probably their normal in some ways. And welcome to Montana, I guess.
That's great. What I wanted to say is if people didn't feel comfortable sharing for any reason or asking questions on the panel, please don't hesitate to reach out to Kim, myself, or any of these guys directly, just to know like we are available in our supportive community. So again, like the downside of not having this, and this is something I found in my own recovery, is like that, what I call the 20-20 club, the 20 minutes before the meeting, the 20 minutes after the meeting. And Kim, when we get to events, and it would be the people that hang out that would stay around. Last time I saw Kim was in Norristown a month ago. We were standing outside in the freezing cold, and families were still tired. It was like an hour later. So again, I wanted to leave a little bit of time at the end. If anybody had any last questions that they didn't feel like, they could text us, they could email us. So again, know that this conversation is just beginning tonight, that it's not over tonight, that this is just a reshaping of how we're viewing our prevention work. So that's all.
Right. So I think even though we said we'd go till 8:30, it looks like we have run out of questions. If anyone else has anything else they want to add from the panel or elsewhere.
Bill here, I just would want to say that, I think we all need to observe that this is a unique time that we're in. And I've been talking to people around the country over the last 2 weeks, and everybody feels some stress and some sort of disorientation about what's occurring. So for everybody in the call and all the panelists and everybody that we come in contact, I think we need to really remind ourselves that self-care is important right now because of we all have additional stress because of what's going on in our world. And so this gives us an opportunity to talk about that and just acknowledge that.
Thanks, Bill. Really appreciate it. Yeah.
Well, Mike, can't thank you enough, and everybody else. Someone just commented, I'd like to say I'm very happy with this type of platform. Being able to bring this into my home and save some travel time is great for me. Feels a way for those who have been leery about attending a meeting can share this at home with their loved ones. Thank you for your time. Well, thank you. Appreciate that comment. And thank you all again so very much. Let's stay in touch, and I will share your contact information. I don't think I have to hesitate in that, right? Everybody, I can share emails and all that. Okay, great. So I'll make sure that's on our site, because I know a lot of people have been asking about some of you and how can I reach out. So I'll make sure that that's out there as well. Mike, thanks. Everybody on the panel, thank you so very much. Appreciate it.
Thank you, guys. I really appreciate it. Thanks again.
Thank you.
Stay well, everyone.